So welcome back. I'm just going to continue off like where we left in the first video, introducing the concept of the inner wounded child. And I'm spending a lot of time, I think, deconstructing or working with trauma right now to kind of uncover the inner wounded child. So I'm going to just keep moving into that direction. One of the things when talking about trauma, again, like I mentioned in the first video, that it is a subjective experience, which means whatever it means for you, really, like however your body um, takes on, the nervous system takes on feeling helpless and unable to escape something, a situation, an event, a circumstance. Now, when I worked with trauma, I uncovered it by using chronic childhood trauma, but this can really play into any type of trauma. So, with that said, I really want to look at the fear and the impact of fear, um, also attachment wounds and unmet developmental needs. And I also want to talk about trauma so that I can talk about how the mind and the body is not separate. So, I'm hopeful that you can perhaps just stay with me. If you can, the concepts are so complex, and I think I'm trying to work with a way just to speak about it that it can be held or you can ponder it however that shows up for you. So I want to talk about maybe psychological trauma. So that means it's not physical, but it's more or less the produced from feelings of terror, helplessness, hopelessness. That to me is psychological trauma or an injury trauma around these things. So it brings me into, well, I think in the last video I talked about relational context. I don't know if I'm going to move into that direction right now, but and just how everything is about relating to everyone else. But I'm just going to hold that for now and maybe bring in, let's bring in understanding trauma and what that is like in a relational context. And if you have read, or if you haven't and would like to, Sabern Fisher, The Fear-Driven Brain, talks about trauma and the analogy of trauma and what that is like in a relational context. So again, I am probably bringing in the chronic childhood trauma and being in a relation with somebody that keeps you unsafe to to hold this. But she says that the analogy is this. So it is like going back. So like, how do I say, like having kindred spirits towards an attacker. So someone's coming to attack you. You're gonna, I don't know, they're assaulting you, and you're trying to be kind to them. So there is an inescapable helplessness, and that's perhaps an analogy of like chronic trauma. So that might show up too at work. It depends on the type of work that you do, but some type of helper, or I don't know, I call it like first response or first responders. They have that same type of analogy in essence, because they're continually going back to the same type of work where there's a sense of helplessness over and over again. And so this kind of recreates a trauma-like effect. Okay, I keep looking here because I'm trying to see if I can pull out little more analogies, or here's one. So a veteran who has reactions to like a bomb going off, has fireworks at his birthday every year type of thing. So what am I saying here? Like, you don't want to have those things, but they keep showing up for you, and you have a response and a trigger to it. So I don't know if that's helpful, but I'm gonna hope that it is. And again, I'm always open, so like ask questions, leave comments, like however you want to do this. You can find me on Instagram, however. But anyways, I really just want to hold that we tend to stay in relationship to something that we are that we are with in trauma with, and I think that's really what I'm holding here. So let's talk about the differences of a traumatic event and being traumatized, maybe. So the difference between a traumatic event and being traumatized, so Bern Fisher will say, is empathy. Empathy after can be all the difference to experiencing a traumatic event and being traumatized. There's a quote that she used in here. I just want to share it. The good enough mother. So this can be any role. This can be, but she says anyways, the good enough mother naturally protects her child when traumatic events occurs that are beyond her control. She validates them and helps her child recover from them. So when you don't have the ability or you're not able to recover from them, that can create a trauma. So maybe just hold that there are other childhood traumas to consider when working with the inner wounded child. And I like to bring it up too, like being bullied. It doesn't necessarily have to be with a caregiver. It could be a teacher not responding, loss of a parent, illness, medical issues in a childhood. Like these things can create a childhood trauma. Okay? And so what happens is with the childhood traumas or in a trauma is that we're always waiting for a corrective experience to resolve it or the developmental task in childhood trauma or in a trauma. And so there's a misattunement and we're trying to attune it, say in therapy, right? So yeah, so maybe sit with that. This might move us into understanding trauma developmentally. And like here I can maybe perhaps bring in the brain here and trauma in the brain, because when I work with PTSD or complex trauma or complex post-traumatic stress disorder, these are the things that I hold. And so maybe as an educational place enlightening that here and the role of the trauma plays on the brain. So the amygdala has three primary affects. So affects are like emotions. It has fear, it has shame, and it holds anger. Okay? So when these are what drives us, so now I'm talking about the survival loop of the brain, like trying to respond to the trauma or resolve itself, staying in a really primal responsive state. When these are what drives us, we are dysregulated, like behaviorally, cognitively, relationally. Okay? And what happens because of that, we store it on the body. So we'll have somatic somatization, like stored on the body, chronic illness, like different types of expressions on the body based on this type of dysregulation in the body. Yeah. So I don't know, there's a video on my website and it's called Trauma in the Brain, and it kind of goes a little bit more into that. But I just want to introduce that concept. Okay, so now I think we've talked about trauma a bit. And I'm just holding if I'm content with that or not. But I think so. I think it's going to have a lot of questions, but and I hope so. Because as I said in the first video, a thinking mind is a mind with a self in it. And yeah, I think it's a good segue to start to talk about the inner wounded child concept itself. And the concept itself is a construct around, well, let us explore fear, hurt, and shame. The construct of the inner wounded child tends to be, anyways, around these emotions or these affects. So what do I want to say here? Let's just introduce this. The inner wounded child can be characterized by the parts of the self that feels the pain from the past, especially fear, hurt, and shame. of the child when the child felt alone, but the ages are specific. Like usually, it's during developmental stages like 5, 7, and 9. So the adult survivor may physically be an adult on the outside, but the feelings inside is similar to the pain that the child may have felt during those developmental stages. So it makes me want to talk about emotions, like feelings. If I'm talking about feelings, like what are feelings anyways, right? So feelings can be described as, well, they're bodily sensations, right? Like a collections of sensations in the body to the brain that we give a name to, right? So like you hear things sometimes like I was sick to my stomach, and or like I was disgusted, or so we kind of like think of these sensations from the body to the brain and we give it a name. And really that's what emotions are, but it tells us how we are. It gives us like a radar, like how we are in relation to a particular current situation. So I don't know, when I break up emotions, that's kind of like how I describe it or how I offer it. And so, yeah, let's hold that. What else do I want to say here? So trauma and recovery talks about, so by Judith Herman, talks about, and so this is just to pull out the inner wounded child, but she talks about disempowerment, disconnection, and core experience, like a core self experience. And so like I'm probably introducing here like the disembodiment here, like away from the inner wounded child in order for us to move on with normal life, to become the adult, and the traumatized psyche. So the inner wounded child, we can talk about it maybe as the traumatized psyche. Yeah, so again, these are really complex. So I'm just, again, just trying to introduce concepts in a way that can be reached or connected to. Which, yeah, like maybe let's hold that for a little bit, because I think it's important to talk about, so this is just an invitation to the concept of the inner wounded child or the traumatized psyche, so that we can begin to work with and begin to introduce like fear around the inner wounded child, maybe hurt or shame around the inner wounded child. And so that we can start to work with or understand trauma or vicarious trauma. Vicarious means that you are like always caring, or you have a responsibility to care. And so that kind of keeps a bind, right? Also, this type of inner wounded child is around like an attachment wound. So you haven't really been attended to, perhaps, empathically understood or seen. So it brings in trust. Do you see how complex this is? So this is all around the inner wounded child. Trust violations, like a feeling of unsafety, not being safe. Okay, so I think for this video, we can hold this here around introducing trauma and how it's embodied, holding the concept of the inner wounded child, and all these constructs around the inner wounded child. Okay? So that's it for now, and I will see you in video 3.